Yo, if you're curious about how someone can go from WGU's nursing program into becoming a full-time nurse anesthesia student, stay tuned. I'm gonna break it down in this video. Yo, what's up guys? Welcome back to A Couple of Nurses. This is Cordero. In today's video, I'm going to be talking about how I went from WGU's nursing program into becoming a full-time CRNA student. So really quick before we get into the content, be sure to like, subscribe, comment any kind of ICU or SRNA related questions in the comment box. I'll read all of them. So this week we're going to shout out 𝘼 𝘾𝙤𝙪𝙥𝙡𝙪. Thank you so much for all the great information. I'm a new grad in a level 1 ICU and need all the help I can get. So we want to say thank you, 𝘼, for commenting. We really try to put out valuable information for you guys, so it really means a lot when you guys show us that it's actually helping you on your journey. So be sure to check out the description box. Remember, we have free resources down there for you guys, but without further ado, let's dive into the content. All right, guys, so there's really just 5 simple things that I did to go from WGU's nursing program to become a CRNA student. So I'm gonna break all of them down. They're all equally important, so be sure to stay to the end so that we can get them all down. The first thing that you have to develop is I can do this type of attitude. You have to really understand that, you know, graduating from WGU, you are at a disadvantage compared to some other students that are graduating with a nursing degree from a more traditional type of program. Just because WGU graduates you with a competency-based grade, so they say that when we graduate from WGU, we have a 3.0, and some CRNA programs don't recognize that. So that is a hurdle that you'll have to get over. And you just have to literally speak directly to these programs to see if they're going to accept you from WGU. So just keep that in the forefront of your mind before we get into these 5 pillars. All right, so pillar 1 is probably the most important, I would say, and that is to get good quality ICU experience. So when you get into the ICU, you want to be sure that you're able to take care of some of the most complex cases. You want to know all of your medications, you want to know their indications, you want to know how they work. You really want to grasp a good understanding of disease processes and how to recognize these disease processes when they're getting worse, when they're getting better. How can we treat these? And you learn that by taking care of the sickest patients. So that's rule number 1. Pillar number 1 is just a good quality ICU experience. You want to join UBCs. You want to get involved in some kind of education, whether it be annual education. Maybe you can become a mentor or become a preceptor. That will definitely look good on your resume and your CV. And really just embrace all of the learning opportunities that come within a hospital organization. So really just embrace all the learning opportunities. Always know that there's more that you can learn. Never have a stagnant type of mentality. Always be fluid and understand that there's always another layer that you can learn deeper. And I think that'll be good for you just developing into a CRNA, because this is a whole new art that you're going to be learning, you know, going from critical care nurse to anesthesia professional. And really quick before we get into pillar 2, let me just let you guys know that this is the route that I took. There's multiple different ways to get into CRNA school, but I'm just sharing with you guys my experience and what I did to get into the program. So you can use this as a blueprint. And if you have any questions, be sure to leave them in the comments. All right, step 2 is to go ahead and get certified. So of course you want to have your CCRN. There are some CRNA programs out there that they say they don't require your CCRN, but you want to get that. That's something that you should just have as an ICU nurse. I believe after you get it, it definitely instills another level of understanding for some of the disease process that we take care of. So I think it should just be standard for all ICU nurses to get it, but I'm kind of biased. And I would also say that even if a program says that they don't require you to have your CCRN, it definitely makes your CV look a lot better when you do have your CCRN. You can also think about additional certifications. I know there's a trauma certification out there. They have a CMC, which is a certified cardiac medicine certification. They have a certified cardiac, I think like a surgical subspecialty. So, you know, go ahead and get those letters behind your name. You might as well, you're not doing anything else, and it's going to help your understanding of how we can care for these patients better. All right, so as I spoke on earlier, WGU, you graduate with a 3.0, and some programs don't even recognize that. So pillar 3 is to take some additional graduate courses. So if you have the money to, I would definitely say go take like an advanced pathophysiology at like a online program somewhere. You can take an advanced pharmacology on an online course somewhere, organic chemistry, You know, you may want to retake your general chemistry. You also may want to consider retaking statistics, a basic statistics class. So what you're doing when you take these courses is that you're really showing that program directors that you're committed to learning, and you're committed to getting into their program, because it's going to look, you know, you have 2 A's and 2 graduate courses. That's going to look great on your CV. Basic courses that you can think about retaking, you can retake your chemistry, you can retake an A&P, statistics, and if you want to start talking about more graduate type courses, you can take an advanced patho, you can take an advanced pharmacology, or advanced or just a general biostats. All right, so pillar 4 is probably one of the most crucial pillars. I'll put it up there with pillar 1, and this is network. So definitely reach out to current SRNAs. You can attend some of these programs info sessions, or their open houses. A lot of them are online these days with Zoom, so definitely sit in, learn about the program that you want to apply to. You know, show your face to the program directors and the staff, so that way you have a familiar face whenever you are submitting your application, or whenever you are in front of that interview panel. You know, they've seen you before. Also consider, before you even apply, is contacting the program director directly. So a lot of these websites, the program director is going to have their email address on the website. So hit them up, ask them questions. You know, pretty much all year they're looking and prospecting for new students. So, you know, show your interest, and I think that can take you a long way. And then pillar 5, there's not really much you can do about, but it really just comes down to luck. Sometimes, you know, some people are just more lucky than others, and you sometimes just have to leave things open to chance. And you know, if you do get a no on your application or after your interview, then if you're really passionate about it, you'll just continue to chop away. You know, you continue to reapply, and continue to prospect for other programs, or even reapply to the program. If this is something to where you know, look at it as a failure, then and you know, and just pretty much shut down your whole CRNA dreams and goals, then that's going to pretty much like infect everything in your life. So that's a long way to say that luck is definitely something that you need to have on your side, and don't get too down if you don't get into your dream school, your dream program, because at the end of the day, it's about becoming a CRNA, and whatever the program has to offer you, you have to pull out the gems. You know, it's up to you to learn. There's a lot of supplemental information out there. There's a big network. So at the end of the day, you're in control of your learning, and really take pride in that. So hope you guys enjoyed the video. Be sure to like, share, subscribe. And if you have any questions related to ICU nursing or CRNA, SRNA school, then be sure to leave those down in the comments as well. We'll see you next week.